Symptom number 3 is neuropathy, encephalopathy, and ataxia. Here I would like to show you first of all what it is. So, about 20% of all progressive ataxia forms can be attributed to celiac disease. And this is one of the curable ataxias. A gluten-free diet can prevent the progression of gluten ataxia. How can we manage that? We have a cerebellar reserve, and during the early time of the development of the disease, we are in a so-called restorable stage. Then we can go back to normal. If we pass the threshold to the non-restorable stage, then we only can stabilize the situation for the patient by a gluten-free diet. If we do not intervene, the ataxia will proceed. So it's very important to early detect gluten ataxia, then we can cure them almost completely. Our goal in the therapy is to stop the progression, and that is only possible in the restorable stage. There are different forms of neuroceliac disease. I just mentioned them at the beginning. We have the gluten ataxia, which is visible with gait disturbances. And one important sign is the Romberg sign, when people with closed eyes can stand alone without any help. Gluten neuropathy is a sensory symptom-associated disease with muscle weakness, muscle pain, numbness, stinging, tingling, and the sensation of wearing a glove. And finally, gluten encephalopathy is associated with abnormalities of the brain structures, leading to, for example, epilepsy or depression. Recommendations for action. Diagnosing of celiac disease is not very difficult. If there are signs of malabsorption or neural symptoms or dermal risk factors or anything else, you start with a patient under a gluten-containing diet. You take the first blood sample and examine total IgA as well as anti-TTG IgA. Then you get two results. If you have a positivity in IgA and a negative testing for anti-TTG IgA, then celiac disease is not suspected. If you have both positive, then celiac disease is suspected, and you have confirmed this diagnosis by a second independent blood sample and a detection, for example, for EMA or a biopsy in elderly people. If you have a negative result in total IgA, then you obviously have a negative result in anti-TTG IgA because there is an IgA deficiency. Then you have to skip to IgG testing. You make the same testing, and if you have a positive result, then celiac disease is suspected. If it is negative, then it's maybe not celiac disease. Even that result you have to confirm with an independent blood sample or biopsy. There are some asterisks at the celiac is not suspected boxes. If you have dermal or neurological symptoms, then it could be a point to consider extraintestinal manifestation and to test for epidermal transcriptinase or neural transcriptinase.